Moving on to the next topic, which is anticoagulant agents. Let's talk about anticoagulants. Before talking about anticoagulant agents and antiplatelets and fibrinolytics, we'll give a basic introduction about how normally a clot is being formed. If you could understand that basic concepts, we can just find out different spots where we can inhibit those particular areas. Again, this will not be the reference for pathology or physiology body. That will be dealt by individual faculties. So here I'm just going to be targeting only those areas which is there in patho and physio, which is clinically important. For example, for which we have designed drugs, only those clinically important areas will be targeting more. So let's start with the first step, and that first step is platelet activation. We have two steps to be explained. One is called as platelet activation. The other one is platelet accumulation. We'll be talking about platelet activation at first. Consider here is where your blood vessel is. The blood vessel is getting broken down, and that's what bleeding is going to be happening. We all know that. Whenever the blood vessel is getting broken down, as we know, the bleeding will start to occur. When the bleeding occurs, we have the first platelet which comes into contact with the collagen, gets activated, thereby releases out a substance which will bind with its own receptor which is there on the other platelets. This will bind with its own receptor on the other platelets, thereby it will produce something called as activation cascade. Simple concepts, the platelet is calling out for help. It is just informing to every individual platelets that there is some issue which is happening over here. We have a bleeding which is there. Please come towards this spot. We have to treat this particular patient. Now we're going to be looking into this particular complex body. We're going to be looking into how exactly this happens, what exactly is released from the platelets, and how it is inducing the activation of the other platelets. I'll be explaining about that in detail over here. Consider here is where the single, that second platelet which we have. On the second platelet, there will be multiple different receptors, guys. We have the first receptor to be explained, 1, 2, 3, 4, 5, 6, 7. If it is passing through the membrane, we have discussed that in general pharmacology. It is a G protein coupled receptor because it is like a longer receptor. When we compress it, it passes through the membrane 7 times. It is also called a 7-pass transmembrane receptor. Now this is actually a GI coupled receptor. Similarly, there will be one more, 1, 2, 3, 4, 5, 6, 7, which is GES coupled receptor. Two different receptors are there on the surface of platelets body. These are the platelets. Now what exactly happens? Now, as we told, this is the previous platelet. From the previous platelet, there will be release of a substance which is named as ADP molecules, adenosine diphosphate molecules. This ADP in turn will bind with the GI receptor which is there on the surface of the platelets. We have discussed about that already in general pharmacology itself body. And this is what type of receptor? P2Y12 receptor. This is P2Y12 receptor. When ADP comes and binds with it, it's going to be stimulating it. On the other hand, what exactly is the one which is stimulating GS receptor? Here there will be adenosine body. We know adenosine will be binding up with this GS receptor, which is actually A2 receptor body, which is actually A2. Adenosine has got A1, A2A, A2B, and A3. Out of this, A2 receptor is there over the platelets, which is actually a GS coupled receptor. Whereas A1 and A3 are GI coupled. We have discussed all of these points in general pharmacology itself. Now, when adenosine is coming and binding with this receptor, it is a GS, whereas ADP, adenosine diphosphate, when it's coming and binding with it, which is GI, which means what is the receivable concept? The receivable concept is going to be adenylyl cyclase.